Although the changing trends of preterm babies' mortality is studied, there is very little information on the specific causes of death associated with this age. Most studies conducted on cause-specific mortality of preterm babies generalize prematurity as the main cause of death without specifying the immediate cause. The data for this study was collected from the NICU's data collection and included 10 different NICUs. This included all live-born infants with less than 32 weeks gestation. Out of 4,454 infants, 345 deaths occurred. All cases of death were reviewed by 3 different authors to determine the immediate cause of death. The findings showed that across all gestational groups stratified, intraventricular hemorrhage was the most common cause of death, with a crude mortality rate of 22 per 1,000, followed by an acute respiratory illness and then sepsis. For those born between 22 to 25 weeks gestation, an acute respiratory illness was the most common cause of death, with a crude mortality rate of 119 per 1,000. For those born between 26 to 28 weeks gestation, it was intraventricular hemorrhage. For those born between 29 to 31 weeks gestation, it was perinatal asphyxia. These findings show that extreme prematurity was strongly associated with increased mortality. However, this study did not separate the deaths according to facility, which could have shown which facility had a higher rate of death. So it is unknown whether a variation in practice affects the crude mortality rate. This is something that should be studied in the future to prevent the deaths in this vulnerable population.